The next presentation is Culturally Responsive Approaches to Evaluation of Cultural Transmission in Indigenous Communities.
Yatehe. My name is Alex Jauregui-Dusseau. I'm a research evaluator with the Center for Community Engaged Evaluation. So today I'm going to discuss evaluation of cultural transmission in Indigenous communities and what my colleague and I have learned in working with the Center for Indigenous Innovation and Health Equity, or CIHE, partners. Cultural revitalization has become a priority for many Indigenous nations and communities following centuries of United States governmental policies, structural systems, and violence aimed at cultural genocide. Cultural revitalization not only results in learning traditional ways of being, but can also lead to healing in our communities. Reconnecting these teachings or learning them for the first time is a way to restore knowledge, confidence, and connection. These photos are from 2 different gatherings in Alaska where participants practice traditional activities. Beyond cultural revival at the community or tribal level, Indigenous interventions such as suicide prevention, food sovereignty programs, often include cultural transmission as a direct or indirect objective. Evaluations of such interventions need to include evaluation of cultural transmission to inform process improvement and effectiveness. So, generally speaking, measurement and westernized research methodologies do not align with Indigenous ways of being and thinking. It can be difficult to quantify cultural transmission outside of Likert scales and attendance. But to indigenize evaluation and to stay true to community engagement, methodologies that align with our values should not be ignored. Cultural revitalization and transmission can facilitate the restoration of food systems in our communities through learning about and then sharing traditional food sources, food preparation, and other aspects of food sovereignty. Communities are not only able to reconnect with those traditional ways, but are also able to sustain themselves. Equipping and empowering others with tools and knowledge helps communities return to food practices that are not only more sustainable, but healthier. In the next few slides, I will share how our evaluation team has worked with the CIHE partners in understanding what successful cultural transmission looks like in their projects and how this is evaluated. So first, I will provide some background information on our role in the CIHE project. As evaluators on the project, we serve to support and build research capacity of each partner to lead evaluation of their projects. We assisted in developing evaluation questions specific to each partner, for example, to what extent has that intervention contributed to cultural transmission? In keeping with the tenets of Indigenous evaluation framework, our goal as evaluators was to authentically engage with partners. The partners know their communities and what they need. Our role was simply to provide a support, but do it in a way that honors the unique customs and values. It was a delicate balance at times between satisfying grantor requirements while staying true to the values of Indigenous evaluation framework. We also engaged in the work with an understanding of the research extraction that has taken place in Indigenous communities. Although we are also Indigenous, we recognize that we have been educated with an emphasis on westernized methodologies. Our relationship with each partner was built over time, largely through virtual meetings and email, where we learned about each other, the goals of each partner, and the impact they wanted to have on their communities. Although relationship building in a virtual space is not ideal, we are proud of those partnerships. So, before conducting the interviews with each partner to learn more about their projects and their experiences and the cultural transmission in their projects, we asked if they would be willing to be interviewed. The development of the questions was a collaborative process, so they had ownership over the process. They took place over Zoom and were recorded with permission. So the purpose of the interviews was to learn about each CIHE partner's experience in being part of the project and what we can learn to improve the experience. We also hope to understand what successful transmission of knowledge looks like in their projects and how it could be measured and how we can help tell those stories. We found that reconnecting people to their culture has been a marker of cultural transmission of knowledge and teaching younger generations traditional practices. Both reconnection and sharing with others was heavily emphasized by the partners. Their communities are in the process of sharing their values, cultural practices, and knowledge with westernized modern society to meet their people's health and social needs. Involving more people in the community and spreading awareness also demonstrates successful transmission of knowledge. The partners acknowledged that it was difficult to identify how to measure this. Westernized methods of measurement do not necessarily align with the storytelling and oral sharing of traditional approaches. Some partners described alternative ways they have measured that engagement and sharing of knowledge. For example, measurement of social media engagements, participant numbers, and seeing how people participate in workshops. Social media platforms are also ways to spread awareness of community events. The focus on traditional foods and food sovereignty were discussed among participants, and the effect has had on their own reconnection of culture in addition to the community's reconnection of culture. Although Westernized methodology is utilized, partners shared they have found ways to add elements of their culture to their projects in a way that is significant to them. These elements may range from including their language on signage to using traditional gardening and planting methods. Data collection methods were also indigenized and traditional storytelling approaches were prioritized. Partners expressed an increase in their own personal knowledge about food sovereignty and the work being done in this area and how they can further work to serve their communities. Talking or sharing circles and providing a safe space for discussion were also methods partners implemented in their project to share knowledge and teachings. Recording and sharing information was done with transparency and care and providing a space where people felt safe. This might counter Westernized methods, but it keeps true to Indigenous ways of being. The measurement of cultural transmission of knowledge is challenging. The measurement methods described in the Indigenous evaluation framework and those modeled after it are not always viewed as rigorous or valued by Westernized researchers. However, if an evaluation project is truly community engaged, then the values of that community should be upheld. So our interviews with the CHEAT partners informed us of their perspectives of that ideal cultural transmission of knowledge, sharing among community members, elders teaching other elders and the youth, and learning about traditional foodways are all ways their projects have restored traditional teachings. Measuring this may not be linear, but these projects demonstrate the value in Indigenous ways of sharing and measuring knowledge. Thank you.